Hello everyone, I am Dr. Priya Satish Chandran. I am a pediatrician working with Columbia Asia Hospital in Puchong. I would like to talk to you about some of the myths that are associated with fever in children. It's not necessary to use cold water, especially when the child is having high fever. Lukewarm water or normal tap water is more than enough. You can use a cold compress, especially on the forehead, armpits, and even the whole body to reduce the temperature. That's not necessary. The child should be allowed to sleep. Most of the time, if they are having a high fever, they themselves will wake up. Then it's okay to check the temperature, and if a high fever, please administer fever medicine. On the first and second day of the fever, the temperature needs to be checked every 4 hours. And if the temperature is more than 38 degrees centigrade or 100 degrees Fahrenheit, the child should be administered the correct dose of the paracetamol. That's the safest medicine to give during an episode of fever. Paracetamol can be administered every 4 hours, especially during the initial days of the fever. It is not recommended to wrap the child in heavy clothing or blanket or sweater and all to induce sweating. The child would become overheated. The child should be dressed in a light and very airy clothing. For example, a singlet and a diaper is more than enough. When the child gets better, naturally the sweating will happen. That actually marks the end of the fever also. Many parents do ask me, can we switch on aircon? It's no harm to use air conditioning, but please don't use very low temperature, like less than 20 and all that. Generally 26 to 28 degrees centigrade. Thank you. Bye-bye.